Hello, this is Dr. Farhangfar. I hope that you're doing well. This is week 7 of the shift, the 12-week Mediterranean weight loss plan. Today we are going to be discussing a very important topic. Most of my patients sooner or later will have problem with weight loss plateaus, and they come to me asking for solution to their problem. So today I want to talk to you about what is a weight loss plateau and how you deal with that. Sometimes you feel stuck in the weight loss plateau and you do not know how to really get out of the situation. Before we get started, I want to give the usual announcement and warning. Information presented in this presentation is for educational purposes only. Please consult your own medical provider regarding the details of your situation. Everything that we talked about here is for information purposes only. Okay, so let's go ahead and get started with the discussion today. Again, most of my patients sooner or later will have problem with plateau. They're losing weight and then all of a sudden everything stops. They're not able to lose the weight the way that they wanted to, and they wonder what is going on, why they're not able to achieve the same results as before. How many times have you experienced this? When you've been eating everything right and exercising consistently for a while, you are making good progress, and then all of a sudden everything stops. You're not seeing the results of your hard work and the scale is not budging. You're stuck in a weight loss plateau with no apparent way out of the situation. You feel defeated, like you think that this is no way out of this situation. Weight loss plateaus are one of the most common reasons women over 40 give up their weight loss goals and they go back to the same way that they were eating previously. So one of the biggest lies that we hear is that it's a problem of willpower. Willpower myth is one of the most damaging lies in the weight loss culture, especially for women over 40. After initial weight loss, your metabolism recalibrates itself to conserve energy. Your hormones change, your stress levels, sleep patterns. Stress is a big factor in patients and people not being able to lose the weight that they want. Also, inflammation is a big factor, and the old advice of eat less and exercise more just does not work very well. So we need a new approach to be able to overcome the plateau. Most people think that it is my fault, I'm not trying hard enough. However, the medical truth is different. Plateaus are not a personal failure. It is your body's doing exactly what it was supposed to do. What is really happening is your metabolic adaptation. Your body becomes more efficient with fewer calories. Again, there's hormonal changes, especially your cortisol level, your insulin, your sex hormones change, make it more difficult for you to be able to lose the weight that you want. Your body is essentially fighting back. It's trying to protect you from what it perceives as scarcity and wants to keep the balanced state. This is a normal biological response. It's not a character flaw. Why traditional approaches fail? Most programs tell you to eat less and exercise more. This actually can work against you if you're not careful, because the less you eat, the more you're pushing your body into a starvation mode, and the more difficult it's going to be for you to be able to ultimately lose the weight that you want. It ignores the underlying medical and hormonal issues and does not approach and address the underlying biopsychosocial factors that are involved in trying to lose weight for long periods of time. So what is required is a holistic medical approach. What that entails is a complete medical evaluation. It is very easy for somebody to go in and get a prescription for Ozempic, but if you are not getting educated on proper diet and nutrition, if nobody is looking at your labs, if you're not getting to the root cause of the problem, then that prescription will probably not give you the best results that you want. So identifying the underlying issues such as hormonal problem, insulin resistance, and inflammation is very important. We need to check the hormone levels, especially for women after age of 40. And also we need to assess lifestyle factors such as sleep, stress, medication side effects. These are very important. Also psychological stresses, relationship with food, food addiction, stress eating, emotional triggers. Those are also very important. Even the environment that you're in, the relationships that you're in, make a huge difference as far as your ability to be able to lose weight and overcome the plateaus. So what is going to work instead of eating less and exercising more? Well, for one thing, you can stop blaming yourself. It's not your fault. It's not your willpower. It's your physiology. You need to get comprehensive medical evaluation. You need to look for the root causes of the problem, not look for a quick fix. And also work with somebody that understands the complete picture and is able to guide you and help you with your weight loss effort. So that is what I've been doing with my lifestyle medicine and weight loss clinic. And this is a very specialized area of medicine. We focus on holistic, physician-led approach. And I will provide you some information if you need to get some more help and more support. You deserve answers, not more frustration. And a lot of times weight loss with confusing and contradictory advice that you get can be very frustrating. So with that in mind, I want you to know that plateaus are normal physiologic response and they can be overcome with right medical approach. And your body is not broken, it just needs the right nutrition and right support to be able to achieve the weight loss goals that you set for yourself. So getting the right support, getting the right help, and getting the right frame of mind and being able to have somebody to hold you accountable and guide you every step of the way is what ultimately will determine your weight loss success or failure. So with that in mind, I want to give you some information. There are different ways that I can be of service to you. There is a checklist that I put together for you. It's a free resource. You can download it below. You can also get my 5-day email course, which is also free, and you can download from the link below. And also there is a 15-minute strategy session available if you need to get on the phone with me and get a short call and get some clarity. So that is also available in the comment section below. Thank you very much and hope you the best in your weight loss effort. If you need help, please reach out There are help available, there are resources available. You don't have to do this on your own.